Hi, good morning to the honorable lecturer, Mrs. Ira, and all my dear audience. First of all, let us give thanks to God because today we can gather in good health. Now, let me introduce myself. I'm Zulfida Devianti K from Class F. Today, in this opportunity, I want to share about a common, yet not truly known disorder, which is an eating disorder. I have 4 points regarding this issue. First is, what is an eating disorder? The factor that causes eating disorder. The common symptoms. And the last is, what should we do to handle this issue? To begin with, let us start with the first point. What is an eating disorder? Does anyone know what is it? No? Okay, let me tell you then. Eating disorder, or ID, is a psychiatric illness with a severe disturbance in eating behavior, emotion, and mind which connects to our food and body. For example, enjoying too much food, to focus on ideal weight, or to focus on ideal shape of the body itself. Eating disorder have different diagnoses. According to Auschwitz Manual Diagnostic and Statistical Mental Disorder, there are anorexia nervosa, bulimia nervosa, and binge eating disorder. A person with an AD diagnosis has to face many obstacles, such as high-risk morbidity with depression and anxiety. Another factor that affects emotion and mind are related to food. Now, as we know what an eating disorder is, let us move to the second point, the factor which cause eating disorder. As we can know, my dear audience, nowadays, in this era, you can see many attractive people, all beautiful people with their body goals. This factor has mainly affected our society, especially in this digital era. The worst is they unconsciously set those as their beauty standard. They set them in their mind. This is why society has tried many ways to have the dream body, which give a lot of pressure on themselves. The question is it wrong? Of course it's not wrong. The one that is wrong is for those who choose an extreme way to have their dreams body. An extreme diet, for example, because not only that it is bad for your health and our mind, but also because this action is one of factor that will highly lead you to this disorder. Wurzboom in 2017 had conceptualized this mental disorder as a result of interaction between symptoms. This behavior is a response of dysfunctional emotion or negative feelings that separate food intakes from the homeostasis process, like the feeling of hunger and fullness. Not only the negative feeling, my dear audience. Happy, delightful feelings can also affect the eating habit of a person. Let me give you an example. My dear audience, this can be applied in the case of someone eating too much food when they are happy. Or maybe they find a pleasure when they are eating too much food, which of course, this is not a normal emotion. Since the patient with this disorder will find it difficult to distinguish between hunger and fullness. Next, the third point, the most common symptoms of eating disorder. The most common symptom of eating disorder can be divided into two. First is internal factors, and second is external factors. Internal factors are neurobiologists, which mean brains anticipate and process food rewards correlate to the way individuals with eating disorder approach food. External factors are experiences of life that are full of pressure, as I have mentioned before, that seem that our life is demanded all of us to be the perfect person. The early diagnosis of an eating disorder starts with a mental disorder approach. Clarification, comorbidity, prognosis, and treatment. This is needed to reach the main problem of a person with this disorder. Have you ever seen or known someone that throw their food as soon as they finish eating? Well, dear audience, that is one of the symptoms of an eating disorder. This disorder can cause a huge problem since it can make the patient suffer from a heart attack, obesity, and diabetes. My dear audience, now we all know about this disorder, right? However, the question is, what should we do and what are the best options to handle this problem? Now, we are on the fourth point of this issue. What should we do to handle this issue? According to the Journal of Diagnostic Vulnerability Factors in Eating Disorder, show that the role of personal standard to be more self-controlled become a crucial factor. It also suggests controlling our body from bad eating habits. In addition, of course, it is also highly recommended to consult to a psychiatrist. My dear audience, we know that this mental disorder is not a mere problem. It is time for us to open our eyes and our mind. Be aware of this problem. Do not let ourselves and our beloved people suffer from this disorder. Well, the most important thing is love yourself and protect yourself. Well, my dear audience, I hope this speech can help you to know more a little bit about eating disorder and become more aware of eating disorder. Thank you for your attention and goodbye.